You're watching the Fox 8 10 o'clock news with Neill McNeill, Katie Nordine, and Max Weather Chief Meteorologist Van Denton.
Tonight's Newsmaker is 25 days into running the medical center that is the Piedmont Triad's largest employer.
She is in charge of making sure the nearly 13,500 employees have what they need to do their jobs and that they're doing those jobs well. And as the new Chief Executive Officer of the Wake Forest Baptist Medical Center, Dr. Julie Freischlag is responsible for making sure the thousands of patients who come there to get well get the best care. And that's not all. It's among the largest collections of buildings in central North Carolina, and the numbers that illustrate what happens inside these and other Wake Forest Baptist Medical Center buildings are enormous. They include 787 beds, 915 doctors, and more than 2,300 nurses.
I saw a comment from a patient that says this is King Kong, they called our hospital. How are you feeling today? That's great. What grade are you in?
But making sure superior patient care doesn't get lost in that size is a key part of Dr. Julie Freischlag's job as the medical center's new chief executive officer. Yes. She's a nationally recognized vascular surgeon who's also served as an administrator at Johns Hopkins and the University of California, Davis. The size, is that intimidating to you?
No, Hopkins was that size, okay. And actually I think what's great about it is then people have more access. You can develop more programs.
Speaking of size, one of the medical center's big stories in recent years has been growth outside the main campus. New facilities have been built in, among other places, Clemens and Davie County. There was the purchase of Cornerstone Healthcare in High Point, as well as, most recently, the Wilkes Regional Medical Center in North Wilkesboro.
Patients and their families really would like their care close to home.
But like most hospitals across the country, Wake Forest Baptist is having to do more with less money. The care it did not get reimbursed for was more than $15.7 million last year as a result of treating patients covered by Medicare, Medicaid, and other programs.
I think our mission is to take care of everyone.
Taking all of the politics out of it, though, I'm wondering, as CEO, what do you really need from Washington? What would you like to get?
I think we need to come to one place where I think health care is a right in this country. It's not a privilege, it's a right. So each state needs to figure out how are they going to deliver health care to everyone in their state. And it's going to be different from state to state. I've practiced in multiple states. How are we going to make that happen? And then looking at preventative ways. How can you reimburse us for preventative ways to prevent illness so we can stay healthy?
Continuing to work for and support new revenue streams, like the work happening here at the Medical Center's Innovation Quarter downtown, will be a priority. Here, for example, products like new vaccines are researched, developed, and sold to private companies, which get them to patients' bedsides faster. Why is research important for a major teaching healthcare facility like this? How does that benefit the patients who are sick and come here for treatment?
I never want them to say 10 years from now, I forgot about innovation. Yeah. And research is the piece that's going to lead to something new that we do, new treatments, new things that we do, the clinical trials in cancer that we do. And patients need to know that maybe it won't affect them, but it could affect their children or grandchildren, that we came up with something new. That
research goes hand in hand with education. The Bowman Gray Center for Medical Education, which is now training future doctors in a refurbished former R.J. Reynolds cigarette factory downtown, is also under Dr. Freischlag's supervision.
It's a haven for education, it's a haven for research, and it also gives you hope. Yeah. It really makes everybody know that we're leading to something new and different, and hope is really why we come to work every day.
And even with all those administrative duties, Dr. Freischlag still plans to see patients twice a month in a clinic and even perform vascular surgery maybe once or twice a month. She says it helps make her part of the team and the culture. It also helps her see firsthand what's working, what's not, and what can be improved. And as if she doesn't have enough to do, Wake Forest Baptist announced just today Dr. Freischlag will serve as the interim dean of the medical school for the upcoming academic year.